Come in.
Hi, Ms. Bosa. How are you doing today?
I'm doing good, and yourself?
Good, good. My name is Nada Silas. I am from the Prairie View A&M College of Nursing. I'm a student nurse there. And I'll be completing your head-to-toe assessment if that's okay with you.
That's fine.
Okay, and I just had a few questions before I start. Have you experienced any headaches?
No.
Any shortness of breath lately?
No.
Okay. Any chest pain?
No.
Any abdominal pain?
No.
Okay, so I'm just gonna go ahead and start just checking your general appearance. So your facial expression is appropriate for the situation. Your hygiene is adequate, your hair is neat, you appear well groomed, and your speech seems clear, and your posture is erect. And now I'm just gonna be testing your mental status, so if you could just state your full name for me.
Amaka Bosa.
Okay, and state today's date.
December 2nd, 2019.
Okay, and where are you right now?
At College of Nursing.
Okay, client is awake, alert, and oriented, ×3 to person, place, and time. The next thing that we're doing is just checking your eye, your external eye. So if you just remove your glasses for me. Okay, so your eyebrows are present bilaterally and your eyelashes are distributed evenly. And close your eyes for me. Okay, there are no lesions or any swelling on your lids, and the color of your lids is consistent with your ethnicity. Okay, you can just go ahead and open them, and the next thing I would do is just test your pupillary reaction. Let me open the door a little bit, okay? And just look straight at my nose. Okay, pupils constrict consensually and bilaterally. Okay, and the next thing that we're gonna be testing is your respiratory posterior. So what I'm gonna do is I'm just gonna inspect. So your thorax is symmetric, your scapula is symmetric, your spine is straight, and you do have a tattoo midline on your spine right here. And your ribs slope down at a 45-degree angle. And the next thing I'm gonna do is test your chest expansion. So if you could go ahead and just take a deep breath for me. Okay, chest expansion is symmetric. And now I'm just gonna palpate. So tell me if you feel any pain or tenderness when I do this. Any pain or tenderness?
No.
Okay, no pain or tenderness noted. And if you could show your back. So now I'm just gonna check your breath sounds. So every time you feel my stethoscope on your back, just take a deep breath for me. Okay? One more. And another one. Okay, so vesicular breath sounds are heard clear over lung fields. There were no adventitious sounds. You go ahead and move towards the front. Okay, now I'm just going to be checking your anterior thorax. So your thorax is symmetric and your costal margin slopes at a 90-degree angle. Your ribs slope downward. I don't see any lesions or any swelling. Your skin color is consistent throughout. And if you could just go ahead and lift your arms for me. I'm just going to be taking your anterior posterior to transverse diameter. So it's 1 to 2, which is normal. And the next thing I'm doing is just checking your pulse. So if you go ahead. So your respiratory rate was 16 breaths per minute, which is in the normal range, and your breathing is effortless. It's relaxed. I don't see any use of accessory muscles or anything. So that's good. And then I'm just gonna go ahead and palpate. So just tell me if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay, no pain or tenderness noted. And I'll just go ahead and check your breath sounds again. So just go ahead and take a deep breath every time you feel my stethoscope. Okay, so vesicular breath sounds are heard clear over lung fields, no adventitious sounds either. The next thing I'm gonna do is just put you in a semi-Fowler's position because we're gonna move on to the cardio. 45 degrees. And I'm just gonna be checking your internal jugular vein right now, so just turn your head to the side. Okay, so there's a slight pulsation there. Okay, so the internal jugular vein pulsation is present, and the next thing that I'm gonna do is just check your carotid. Okay, your carotid artery is 2+ bilaterally, and now we're gonna move on to your heart sounds. So I'm just gonna go ahead and go to the sternal notch right here and go to the second intercostal space. So this is your aortic area. Your pulmonic. Third intercostal space for your herbs. The fourth intercostal space for your tricuspid. And the fifth intercostal space for your mitral. Okay, so S1 is heard loudest at the apex near the fifth intercostal space, and S2 is heard at the base at the second intercostal space. And your heart rate sounds regular. Now I'm gonna go with the bell to just check for any extra heart sounds. So aortic, pulmonic, herbs, tricuspid, and then mitral. Okay, so there was no S3 or S4 heard, and no extra heart sounds, and no murmurs. The next thing that we're gonna do is move on to the abdominal assessment. So I'm just gonna lay you down. Okay, and I'm just gonna inspect the stomach right now, the abdomen. Okay, so your abdomen is flat. It appears symmetric. There are no lesions. You do have a belly button piercing, and I see you slight respiratory movement, and there are no. Let's see. No extra pulsations present, and your umbilicus is midline and inverted. Okay, and now I'm just gonna go ahead and auscultate, starting at the right lower quadrant. So bowel sounds are heard in all 4 quadrants. Now I'm gonna go ahead and do light palpation for you. Okay, abdomen is soft and there is no involuntary guarding. Now I'm gonna go ahead and do deep palpation. Okay, so no enlarged organs or masses are felt, And did you feel any pain or tenderness when I did that?
No.
No? Okay, so no pain or tenderness noted. And then we're gonna move on to peripheral vascular. So if you could just stick your arms out for me. Okay, so arms are equal in size. Skin color is consistent throughout. Patient does have a few tattoos on the forearm and on the upper arm. And so now I'm just gonna go ahead and touch for warmth. Okay, so skin is warm to touch, and now I'm just gonna go ahead and feel for edema. No edema is present. And now I'm just gonna go ahead and check for clubbing. Just go ahead. Okay, so no clubbing is present. And now for capillary refill. So capillary refill is less than 3 seconds. Now let me just check your radial pulses. Okay, so radial pulse is 2+ bilaterally. And now we're gonna move on to the legs. Feet, okay? So I'm just gonna go ahead and inspect your legs. So they appear equal in size. Patient does have a few scars on her legs, and she does have a tattoo going along her leg and her foot. Okay. And now I'm just gonna go ahead and check for warmth. So. Okay, so skin is warm to touch, and now I'm just gonna go ahead and palpate for edema. Okay, so no edema is present. Then I'm gonna go ahead, and I noticed that she has nail polish on, so I'm gonna check the capillary refill at the dorsal part of her foot. Okay. Okay, so capillary refill is less than 3 seconds. Then I'm gonna go ahead and check the dorsalis pedis pulse. Okay. Okay, so the dorsal pedis is felt 2+ bilaterally. Now I'm just gonna go ahead and check the posterior tibial. Okay, so the posterior tibial is felt 2+ bilaterally. And that completes your head to toe assessment. Did you have any questions for me?
No, thank you.
Okay, great.